As a community stoma care nurse, I call to people's homes as soon as they get home from hospital. One of the first things I do is just ask them if it's okay for me to help them change their bag and make sure everything's okay. One thing I have noticed is that a lot of people when they get home like to use maybe some gloves, sometimes an apron. But what I like to stress to people when they get home is that really once you get home you don't need to use gloves or aprons. You have to remember that when people are in hospital, the nurses and doctors use gloves, aprons and now masks to make sure that they're protecting patients as we're going from one patient to another very quickly. Whereas in the community, we would wear gloves and aprons for the same reason, but for you yourself, you're looking after your own body and you don't need to wear a glove or an apron, because just think before your surgery, when you went to the bathroom, you didn't use gloves to wipe your bum. So if you're cleaning around your stoma, as long as you're comfortable to do so, you don't need to use gloves in the cleaning of your stoma. In fact, sometimes using gloves can get in the way if people are using flange extenders or if they're using little seals, and even just taking the backing off the bag. Sometimes the gloves can actually stick to that and it can make it that little bit more difficult to do a bag change. So really, if you're comfortable enough and if you'd like to, you can do your bag change with just some clean water and just your hands and some soft wipes and all of the bits and pieces that you need. There's no real need to use gloves or aprons when you're at home.